Hey everyone, it's me, Dr. Whimsy, and today we're talking about arthritis, osteoarthritis, and what you can do in terms of natural medicine to help ease any chronic pain you may be experiencing due to arthritis. Arthritis is something that we all are at risk of experiencing if we are over the age of 40. Arthritis is extremely common, for example, in the lower back of people over 40, but we also see it quite a bit in the hands and in the knees. The most common time to feel pain due to arthritis is usually in the morning, just as we're waking up. People with arthritis will often complain of aches and pains in the morning, just as they're waking up. Also, you may be experiencing aggravation of arthritis due to repetitive motion, like playing a musical instrument, typing at a keyboard, or in extremely cold climate. When you're working out in that garden and it's really kind of cold, you may be experiencing pain and stiffness in your hands. So what are some things that you can do to reduce your chronic pain due to arthritis? Well, for starters, we talk to people about exercise and whether or not they are stretching and moving in a healthy way and taking frequent breaks if they are engaged in repetitive motions. For example, when you first wake up in the morning, if you're experiencing stiffness, aches, and pains, you might want to get up and just stretch a little bit gently. Don't force the stretch. Don't try and stretch beyond a comfort zone, but just gently rocking and stretching in and of itself can help loosen your muscles, loosen your joints so that you can experience less pain throughout the day. The other thing we talk to people about is diet. Now, there have been some different studies about types of diet that may alleviate pain, and there's actually been some compelling arguments. For example, many naturopathic doctors will recommend what's called an anti-inflammatory diet, and that's a diet that basically helps reduce inflammation by removing foods that may aggravate or cause an increase in inflammation in the body. Some of the things that we talk to people about that are dietary choices include reducing sugar, reducing processed foods, increasing consumption of foods rich in omega-3s, consuming less calories, so that you're actually walking away from the table 80% full. That in and of itself can help with inflammation and chronic pain. So if you were to, for example, just make the habit that for 1 week you don't take second helpings and you reduce your caloric intake by 20%, and then just see if you've experienced any relief of symptoms of chronic pain simply by reducing caloric intake. Other things we think about that can reduce chronic pain include simple spices that are available in most people's home. For example, ginger tea is associated with decreasing inflammation in the body, and so is turmeric. Both of them are fairly inexpensive. They're related to one another, the two plants, ginger and turmeric, and they both are associated with decreasing inflammation. Other foods that are associated with decreasing inflammation are foods rich in bioflavonoids. Those are foods like the berries. You can get those organic and frozen for very little money, but also some of the citrus fruits can help because they're rich in bioflavonoids. However, some people may be sensitive to citrus, and it's something that definitely can be an aggravation for some people with arthritis. So you may want to make sure that you're finding bioflavonoid sources that don't cause inflammation. There is some supplementation that is sometimes given to help ease inflammation. For example, we might prescribe a B complex in the coenzyme form, 1 to 2 a day. Vitamin D is good for overall health, and we certainly would check vitamin D levels for a patient that's experiencing chronic pain. And last, we would recommend omega-3s, possibly in supplement form, if a person isn't consuming fish 2 to 3 times a week. All right, so those are just some simple things that you can do to decrease inflammation in your body. And I want to just recap here. Number one, when you first wake up in the morning, you want to do some gentle stretching. Never force a stretch. And throughout the day, take frequent breaks if you are engaged in any kind of activities that are repetitive that may be causing pain. Number two, we would like you to consider reducing your caloric intake by about 20%, simply by reducing the amount of calories you consume in the day. You may be seeing a decrease in inflammation, and that may alleviate symptoms. Number three, we talked about an anti-inflammatory diet. Anti-inflammatory diets are sometimes prescribed by naturopathic doctors, and they can certainly help alleviate pain. And last, we talked about some foods and supplements that you can take that may also alleviate inflammation. That includes eating foods rich in bioflavonoids and omega-3s. And if you'd like to supplement, there are great herbs like turmeric and ginger that can be incorporated in your diet, and supplements that can help include a B complex in a coenzyme form and vitamin D. All right. That just about wraps it up for me here on Dr. Whimsy. I hope you enjoyed watching this brief lecture on how to decrease chronic pain due to arthritis with natural medicine. If you'd like to find out more about my work, you can go to drwhimsy.com. I am available for telemedicine. Or if you'd like to find a naturopathic doctor in your area, you can go to the American Association of Naturopathic Physicians. Thanks for watching. Bye-bye.